AI is what we hear every day now in our daily lives. Artificial intelligence has encroached many job sectors and professions. Will it be a boon or a curse of the medical field? Welcome to MedVentures, and I am your host, Dr. Vivek Vincent. Here, we explore the cutting-edge intersection of artificial intelligence and healthcare. Join me and Dr. Kurian on a journey to understand the innovative landscape of AI-powered solutions transforming the way we diagnose, treat, and manage health conditions. Whether you are a healthcare professional, tech enthusiast, or simply curious about the future of medicine, this podcast is your guide to understanding the incredible impact of AI in healthcare. Hello, welcome Dr. Kurian for our episode of MedVentures.
Thank you.
In spite of your busy schedule, you took time for us. And today we are here to talk about a very emerging topic, which is AI or artificial intelligence. So, being an orthopedic surgeon, apart from your busy schedule, you started having some interest in AI. What brings you to AI?
It all started when I was doing my MBBS. Okay. So when I was in my medical school, I was in my third year and I was doing medicine posting. And then I realized there were tons and tons of diagnoses for a patient to have. So when I considered, so I finished my first year in anatomy, physiology and biochemistry. And we used those information as a base along with pathology, pharmacology and microbiology to diagnose the cases in medicine. So then there was Davidson was a textbook, and there were tons and tons of diagnoses. And then I realized if the symptoms and the signs of the patients could be analyzed, and they could provide a better diagnosis than humans. Because when you consider textbooks, maybe 30 years or 40 years, I'm talking 1980s and 1990s.
Right.
If you take a pathology textbook, it will be maximum 500 to 800 pages. But the present day pathology textbook would be around 1,500 to 2,000 pages. So the volume of medical information has gone up really high.
Okay.
And a single human or maybe a group of humans cannot handle medical information. Just to remember them itself is very difficult. Only if you remember them, you can analyze and then you can apply it to the patient. So in the usual practice of medicine, what we do is we have a common group of diagnoses, and we try to put them in those groups, and we see the confirmation. We have this confirmation bias that is working on. So we try to fit the patient into our diagnosis rather than being more open to other diagnoses. So there's a saying called common diagnosis is commonly correct and the rare diagnoses are rarely correct. But the question comes, when does the rare diagnosis become correct and when does the common diagnosis become correct? So then I realized that humans are actually incapable to analyze and diagnose diseases really accurately. I'm talking about the real accuracy of diagnosing disease. So then I explored different things, and then I realized you need something like a computer. You need extremely a better computing device to diagnose diseases and provide proper care for the patient. So it's like in conventional medicine, we treat patients. A majority of them, maybe 95% of them, will be happy with our conventional treatment. But there is a percentage of maybe 5 to 10%. It's all a ballpark, but that could really get a good beneficial by having a superior computing power than human. So that is where I started my interest in artificial intelligence.
So, do you feel artificial intelligence is mainly for the rare diseases?
No, artificial intelligence is trying to be more of a superset rather than a subset, because in 1600s, Sir Isaac Newton has discovered gravity, but present concept is not including his theory of gravity. It's more into the theory of relativity by Einstein. The gravity is being considered, but again, the Newton's theory of gravity is a subset of the superset that is presently being considered as a theory of gravity. It's on based upon Einstein's theory of relativity. So AI, I feel, is going to be a more of a superset than a subset of medical care, because that can have the larger picture, which humans can't perceive because they are incapable to perceive such things. So I feel AI can be a more better outlook in having a better perspective about disease rather than a subset.
So, when did AI ever originate, and how has it evolved over the years in healthcare?
Yeah, so AI originated in 1950s by Alan Turing. So he didn't explicitly mention the term artificial intelligence, but he implied of intelligent machine that can simulate human intelligence. So 1950s, he actually, before his death, he has actually implied, he made a test called Turing test. Turing test.
Nice.
So the Turing test implies that if a machine or a computer can pass the Turing test, it can be considered as an artificial intelligence, because the Turing test is, there will be two listeners. One person will be responding to the messages.
Okay.
The other person will be also responding to the messages. One will be a human, the other one will be a computer.
Mhm.
So if the person on the other side cannot discriminate between these two messages, whether they are human or computer, that is called Turing test. So that was devised by Alan Turing in early 1950s. The term artificial intelligence was put on in 1950s, 56, and the artificial intelligence really took off in a conference at Dartmouth College in US. In those conference, a lot of people, for example, John McCarthy, these people were into artificial intelligence, and they were trying to take on the computing devices at that point of time and trying to progress it. And when it comes to the medical field, it was in 1970s.
Mhm.
A program called MySyn was created to identify infections in blood. And later, artificial intelligence research went in for a window, in the sense they didn't have any much funding or any technology. So there were two AI windows. One was in late 70s. The other one is in late 1980s and early 1990s.
Okay.
So the irony was that the Terminator movies was actually originated during the second AI window.
Nice. Okay.
Okay, so that was the AI windows, and then AI slowly picked up. One important thing was called PAPNet. One AI program called PAPNet was good in computer vision, so good that it could analyze thousands of pap smear samples more efficiently than humans.
Okay.
So because based on computer vision. So that is the general history of AI, and then slowly by early 2000s, there started becoming an exponential increase in AI research in medicine, and now it is going really exponentially high in AI research.
Which all fields currently is AI welcomed and being used very routinely?
Yeah, so the question comes, why AI in medicine? So as I told you before, it is medical data has become very complicated.
Right.
Just when you learn in textbooks in MBBS and your post graduation, just like this. So to analyze more and more data more accurately, you require AI, and it came up in two fields like pathology and pathology and radiology, where they could do computer vision. So computer vision is one branch of artificial intelligence.
Nice.
So computer vision was working on pathologic slides and radiology images.
Okay.
Both CT images, X-rays, MR images, PET images, everything. So
They would
slowly,
make a database.
yeah. So they started learning. So when you consider AI, so AI got different branches. So one is machine learning.
Mhm.
So machine learning is where, as the word implies, the machine learns, just like how we learn.
Okay.
We see 10 Maruti cars, and the 11th Maruti car, we can identify it's a Maruti car. Just like that, machine learns from the database, and then they predict new data.
Okay.
So that was machine learning. And after some time, deep learning became a subset of machine learning that has become really good. It became so good that it started exploding like anything. And deep learning is the part of AI that is primarily working in computer vision. So they are really good. And the another subset is natural language processing. The human natural language can be processed by the machine, and they can even reply in the same similar languages. That is NLP, or natural language processing. And then came this computer vision, and then another big branch that is onto the development, that is the artificial general intelligence.
Okay.
Artificial general intelligence, where the AI is almost akin to humans. They do everything a human does. So these are the few branches of AI, a subset of AI. So computer vision has come up really well in medical field, and that is where that was happening in pathology and microbiology.
Okay.
And radiology. So there are now certain CT machines and MRI machines that is equipped with AI coming up.
Right.
The problem is that it is slowly coming up. So these are the fields initially. That is,
do we have any clinical branches which have AI?
Yes. So there are a lot of medical diagnosis.
Okay.
So, for example, there's an example that large language model, it's a part of natural language processing. You would have heard of ChatGPT.
Right.
So there was a case when a mother couldn't find the diagnosis of her teenage son. After almost lots of doctors were shown all over the country, and she could find the diagnosis by giving data to the large language model, and the diagnosis came as tethered cord syndrome, and it was an accurate diagnosis.
Okay.
So in case of diagnosis also, the large language models by AI is becoming really good at it, finding out the right diagnosis. As I told you before, because large language models can analyze a lot of medical data sets and medical knowledge, so they can process and they can do it really well. Of course, they are not without flaws, but
right. No, but sometimes now if we go through ChatGPT, there is always a line of caution written below that we may not be right.
Yeah.
So can we consider all diagnosis to be accurate on such platforms?
Yeah. So the question comes whether the accuracy of AI. So the accuracy comes from AI starts from basically learning. So machine learning is the basic thing. So the data set they are fed in the beginning is the key where the first thing can go wrong. That is the bias.
Right.
So, for example, if the machine learning model has been fed with the data of all Indian population, it could be difficult to use that machine learning model in an African population, or in a European population, or an American population. So that's a racial bias.
Right.
Then there could be gender bias. If the data set is primarily females, so it won't apply. I mean, it can apply, but it won't be fully accurate for a male population. So a thing called bias is there in a machine learning model. So how you train the machine learning model, how you train the AI is the most important thing about the accuracy of AI. So that is why we always see a caution when you look at AI. But the thing is that if they can analyze all the data, and we can look into the data they have learned on, we can always we can monitor them.
Right.
Yeah.
Who feeds the data?
We start feeding them data. So for example,
are there a group of people who
so the thing,
selected just for this job?
It's a stage in machine learning. There's a stage called dataset preparation. That is a very important stage of making a machine learning model.
Okay.
So making the dataset is very critical. So it's a time-consuming process, classifying them into different groups, and removing the other things which are not required in the dataset. So it is a difficult process, and dataset preparation is one of the most important steps before training the machine learning model.
Is there a particular company or a particular body which decides what kind of information should be put?
Not really, actually.
So can anyone put up information?
No, what I'm trying to tell you is that if a medical if a medical machine learning model is being made, for example, if it is made under a body, for
Right.
example, if it's an international organization,
Mm.
of course they will be having guidelines for it.
Right.
Okay, but anybody can make a medical machine learning model.
Mm.
So there's nobody stopping you from making a machine. That is exactly the reason
Right.
we should be careful.
Okay.
So a regulatory thing, for example, in cryptocurrency, there were no regulations.
Right.
So a lot of people lost money. So the same thing can happen in AI.
So currently, is it regulated?
FDA approval is the most important regulation that still stands.
Okay.
But even FDA approved machine learning models doesn't work properly outside the institution.
Okay.
It's called data set shift. For example, if I make a machine learning model in my institution or in my group of institutions, and then we try to see the accuracy of the prediction in another institution. For example, I analyze thousands of X-rays in my institution and try to make a machine learning model to detect angle fractures. And I use the same machine learning model to detect angle fractures in another group of hospitals. It may not, it may not predict accurately.
Right.
It's called a data set shift.
Mhm.
So the problem is that you need external validity.
Okay.
So just by having an internal validity may not even, it has even happened to FDA approved AI models also. So I had read a systemic review last year about it. So what they say is that having an external validity is very important when you consider the accuracy of the machine learning model.
So would the future be an institutionalized AI bot or a universal kind of?
The problem comes similar to what is happening right now.
Mhm.
There are qualified doctors, and then there are quacks. So there are a lot of pseudosciences happening in YouTube and not social media. So similar thing can happen. So it's better if you go for an approved AI model, because anybody can create an AI model.
Right.
But we don't know how good it is. So it is better if we go that is regulated rather than.
So always look for something approved by the
Yes.
government body.
A government body or any scientific body. Scientific body. It could be our government or our institution. But it is better because we don't know what is happening inside the training. So primarily, we have to explain.
Right.
One of the important thing about AI is that the explainability. Why AI classified this X-ray as fracture, or why AI classified this case as a tumor. You should be able to explain it backwards.
Okay.
So sometimes they say it is a black box. For example, in large language models or in certain models where they have detected that data, they can't explain why AI predicted like that.
Right.
So there are multiple issues. Bias is one issue. Lack of transparency is another issue. Accountability is another issue. So ethics in AI is very important.
Right.
And AI ethics by itself, it's a separate branch that has become a bigger branch because the ethics in AI is very important.
Right. So now we got to know a lot about imaging and getting to know some diagnosis.
Yeah.
How does AI help in patient care?
So one good thing about AI in patient care is that one, in public health.
Right.
So when we consider public health, if before the patient reaches a doctor, you can make AI chat bots that can help them in screening their own diseases, when to attend a hospital, and a lot of public health issues they can answer just by an AI bot.
Okay.
And then in patient care, AI can reduce a lot of errors in patient care. So if AI can help in guiding the treatment, it can get inputs from the guideline, standard treatment guideline, and help in giving the accurate treatment to the patient. So it reduces a lot of errors in the treatment. It can reduce a lot of patient side errors, medical side errors, and of course the care side errors also. So it helps a lot in patient care, and it helps in by getting a good diagnosis and good treatment guidelines. By depending on AI to get a good treatment guideline, helps in a patient getting one of the best treatments in the world, anywhere in the world. because AI, if the AI is democratic, if you are democratizing the AI, all over the world, the patients could be having the best treatment possible, wherever be the institution. So because they follow the guideline.
Right.
So that is one thing, good thing about AI patient care, and it helps a lot for the patient.
So, in such a situation where, as you mentioned, they can get treatment from anywhere,
Yeah.
will there be a rise in quackery?
Yeah, that's exactly why we need a regulatory body. So when we try to implement AI, it requires a lot of scrutiny, and they should be able to. There should be transparency.
Now, what I meant is now, if a quack goes through, now a patient comes to him
Yeah.
or her,
Yeah.
and he understands the symptoms.
Okay.
I mean, he doesn't know the diagnosis,
Okay.
but he can also treat
Yes.
by chatting with
Yeah.
the bot,
Yeah.
rather than going to a
Oh,
professional.
you're talking about an unqualified patient
Yes,
using AI as a tool to treat the patient.
right.
It's a possibility. I'm not denying that, but it requires screening. Yes, because a lot of medical, we can have gatekeepers for medical data,
Mhm.
and can give access only to the medical professionals, access to the data of the medical AI. We can do that,
Right.
but it depends upon the policy of the individual countries, how they are being followed.
In the current scenario of hospitals, a lot of our record or history writing is on computer.
Yeah.
The current generation are okay with it. Couple of our senior generation people are still not ready to type in data in a software.
You're talking about electronic medical record.
Electronic medical record.
Yeah.
So similarly, if some people are hesitant in doing this, what do you feel when AI comes into picture? What is the relevance, or what do you think will happen to the current healthcare profession?
So what happens is right now there are physician assistants. They can input the data for electronic medical records.
Okay.
So as I told you before, NLP, that is a natural language processing, is a subset of AI. So what it can do is senior personnel and also anyone can input the data by conversational speech, conversations by themselves. They can just speak to the computer and it will get automatically recorded. They don't have to type in data. They can listen to what they say. And because the AI can analyze the data, so they will structure the data in the EMR in a way that it is be more easier.
Mhm.
It will be more faster than writing on a case sheet.
Okay.
So AI can make it more faster actually, and that makes AI more inclusive. That includes more young people and also senior personnel. So it makes it more inclusive in case of electronic medical records.
And what about what do you feel, that will people feel threatened, that will they lose their job? Will there be a shortage of in their occupation?
So what it's a common perception that when AI comes, jobs will be lost.
Right.
Which is true in a sense. For example, when computers and internet were there in early 90s, when they started becoming more mainstream,
right,
lot of traditional jobs, for example, when you take a bank ATM, people rarely visit banks for withdrawing money. They just go to the ATM
right,
and they withdraw money. But that doesn't mean that the jobs have gone. The traditional jobs will go and newer jobs will come. According to IBM, maybe 70 million of the jobs, if the jobs lost and the jobs gained will be more.
Nice.
For example, if X number of jobs are gone, X plus number of newer jobs will come, but they won't be traditional.
Right. A new form
of jobs will come as the application has improved. The thing is, that will be the last time. That is when the AI comes and there will be a boom of jobs, and that is the last time there will be a boom of jobs.
Okay.
Because AI, there are a lot of famous people saying that AI is the last invention of human. Because AI then continues inventing newer things.
Okay.
So that's the concept. So, but newer jobs are coming, And it won't. It will shrink the job market in the traditional sense,
Mhm.
but there will be a boom of newer jobs. Those jobs were not there maybe 10 years back,
Right.
but there will be a boom of jobs. And for example, data set preparation by itself takes a lot of manpower.
Mhm.
So there will be a lot of jobs, but traditional jobs will be cut. And we can see presently big companies like Meta, Google, they are laying off their employees because a lot of AI has
Only
come help
replaced.
here.
Right.
So traditional jobs may not stay, but newer jobs definitely will come, and that will be more than the traditional jobs. So it will be good. People could adapt to the newer jobs, just how the mainstream computers and internet have come. But people should be willing to be adapt.
Right.
Yeah.